All right, then. Good day, and today we have another episode of Dai Good Talk. This is our entrepreneurship segment, and we have a special guest. She will introduce herself.
Hi, good day. My name is Dr. Nalinee Rampersad. I'm a dentist. My office is located at KVS Plaza in St. Helena.
Right.
The name of it is Holistic Healing Dentistry Limited.
Okay. So, what inspired you to become a dentist, and when did you realize that this was your calling?
Well, what inspired me to become a dentist is when I was younger, honestly, I took out all of my teeth for myself.
It took it out.
Yes. And I have them here
Yeah.
to show, right? A friend was telling me in primary school, I even took out some other kids' teeth in class.
Also, you were fascinated by teeth at an early age.
I don't know if it was fascination or it was just, I don't know what it was, but yeah. And my sister kind of led me down this path too because, I don't know, she became a doctor.
Right.
And she was saying, if you really want a life and you want a life after your job, do not become a doctor. And I was like, okay, well, I feel like I want to be a dentist. And when I continued to go along that path, I started to really enjoy dentistry. The first 2 years, we do med with everybody else, and then we branch off into dentistry.
Right.
And when we started to do the labs, I really enjoyed all of the hands-on
Right.
things that we were doing.
So basically, is it fair to say that your early stage of experimenting with teeth made the lab work somewhat more fascinating?
Kind of, yeah. A little bit, but just the hands-on aspect of it. Like some people in class did not enjoy labs at all. And I was just like, I love this. I love working on the phantom head labs, like just doing the preps.
Yeah.
I really enjoyed doing that. And then in year 3, I think we were able to go onto clinic.
Right.
And that was a bit nerve-wracking to transition.
Yeah.
And I remember I was the first person to give anesthetic. And my whole class was just surrounding me, like waiting to see. And I was just like, this is so nerve-wracking. But it was really good and I enjoyed it. And I enjoyed like getting to know my patients and stuff like that. So
Right. Yeah. So it was somewhat of a calling for you.
I believe so, yeah.
Yeah. So I heard you mention about keeping your baby teeth in a tic-tac box.
Yeah.
What does that symbolize for you now?
I don't know, it really feels like destiny kind of make a full circle. Because when I look at it, I'm just like, I have all these baby teeth here still, and that I kept it for so long without, it was not like a conscious decision I made. It was just like something that happened that I was just like, and as more time passed, I just amazed that I kept this for so long. So
Was it that you were keeping it for the tooth fairy?
yeah, so it's supposed to be a big payout day.
Yeah.
But I just really, I don't know what it was that made me keep it, but
Yeah. All right.
it feels like it came full circle.
Many patients usually fear the dentist, right? What motivated you to create a space that eases anxiety for your patients?
So yes, that's true. I feel like 80 to probably 90% of patients are terrified of going to the dentist. I'm always greeted with, I hate going to the dentist, or I'm so scared. And that triggers something in me to want to comfort them and let them know, the fear is keeping you from getting the work done and is actually making it worse. So as more time passes, the issues are going to get worse, and the anxiety that you're having now is not going to change next year when you have to come and do it, or in a few months' time when you're forced to come because of the pain. And, I always try to tell them prevention is better than cure in terms of you come and get your 6 months checkups and you avoid that whole issue of waiting and the anxiety building. So for me, I really want them to understand and create a space where they feel so comfortable that they enjoy, at least enjoy coming to this space and feeling relaxed enough to take care of themselves in a way that the anxiety kind of decreases with each visit.
Right.
Yeah, it's very important.
So that they come for their regular checkups.
Yes.
And how often should they be coming for checkups?
So you should get your checkups done every 6 months.
Every 6 months?
Yes, at least get your checkups and cleanings done every 6 months.
Right.
And that way we could see if things are developing and if you have new stuff developing, because when you don't floss, you obviously will have more issues building up.
Right. Okay. So can you share a story about a patient whose transformation really touched you? You don't need to call the patient name, but just give us a general story that...
Yeah, actually, yes, I could think of one. So there was this patient who had severe anxiety, like severe. She couldn't even sit on the chair without her husband holding her hand.
Right.
I would talk to her and I would say, you could do this. Let's do some breathing exercises together. I would do the breathing exercise with her. She would kind of be a little okay then. And for like severely anxious patients like that, I would do some affirmations. So I would say, I'll let them say, I am courageous, I am brave, I can do this.
Yeah.
And she was okay to a point, like even lying fully back, I know that's a vulnerable position for a lot of people.
Yeah,
it makes them
feel
even more scared. And even going back, she couldn't do that. So I had to work at a kind of uncomfortable position where she's not too far back. But for the dentist, it's kind of hard if we don't put the patients back to see.
Yeah.
And
because I was showing your back and then your eyes
and neck. Yeah, it's terrible. So I put her back to a place where we could compromise. And, she was like, if she could listen to music. So I said, yes, of course, bring your headphones next time. She didn't have it at that visit. And every time that she would come, I would see her fears melt a little bit.
Yeah.
And she started actually employing some of the things that I would say. She started implementing it into her daily routines.
Right.
So I would tell her, do a little meditation, like 5-10 minutes a day, if you could, to help, because I'm seeing her anxiety affecting not only, it's not just in coming to the dentist, it's affecting her life in, in other ways. And with each visit, she started to tell me, it's helping me so much. The affirmations, the meditation is helping her in every aspect of her life. And that, it really touched me to know that, she's actually listening to what I'm saying. And I could see the improvement at the office. And I'm sure, she was seeing the improvement in her personal life as well.
Okay.
Yeah.
So, as you mentioned, meditation, right? The meditation room is a unique feature in your practice. And how has that impacted majority of your patients?
Me personally, I love the meditation room.
Tell us about it as well.
I really love it. I think it is the first dental office with a meditation room.
Right.
I don't know. I think I really did implement that from my personal life, what I do. I meditate every day and I use it. I think I use it more than anybody. But patients are always like amazed that there's a meditation room here. And at the dentist, inevitably, most times you have to wait, right?
Yeah.
Because there's unforeseen things happening in the surgery sometimes. And I'm always thinking about ways that patients can wait in like a way that can benefit them. So as I was brainstorming before we opened the office, before we even started doing anything, I thought about different things that would help people wait in a way that's beneficial to them. And the meditation room was like a really good one because it calms their nerves, it calms their nervous system. And if you listen to something like a guided meditation, like you come in 10 minutes earlier than your appointment, you go sit in the meditation room. And I have patients that did it.
Do that, yeah.
And they really feel very calm going onto the chair, accepting, okay, you have to get injection. May not be as comfortable, but their body is now in a more relaxed state. Yeah. Their nervous system is calm.
Right.
And their mindset is shifted to a more relaxed, accepting.
Yeah.
So it has been it is a unique addition to the office, and I love to see people's reaction when they come in and they see it.
because it gives a good experience.
Yeah, it does. It's like some people actually, they're excited to go into the meditation room before they come because they never had that experience before. They never even heard of it. So every time I show them, because I try to add a little thing to it ever so often when I can to make it more cozy or more, kind of take you away into a different space.
Right.
Yeah.
Okay. All right.
Yeah.
So, What role does mindfulness play in your daily routine, and how has it shaped your work?
Mindfulness is, I would say, very important.
Mm-hmm.
So from the day before, like from the night before, I have to think about my day, like in as much detail as possible.
You plan it.
Yeah, I have to before I sleep.
Right.
And if it's a difficult day, like I have some complicated procedures, I would try to plan and be mindful of each possible way that that procedure could go and how to handle it. So mindfulness is very important. So yeah, I do that. And on a morning, I would do some affirmations, going consistent. A few years now, every morning I would do affirmations. Just to be, you really have to be mindful in everything that you're doing. That way, you're able to, navigate a little bit better. So yeah, it is very beneficial and I do try to practice it on a daily basis. So, yeah.
As you mentioned affirmations a lot for yourself and for your patients, right? Where did that whole concept come up for you? How did you start knowing about affirmations and then using them?
I believe it was about 5 years ago. I think a cousin of mine sent me some affirmations or like a video on affirmations or something like that. And I'm a kind of routine person. So I'm like, oh, this sounds great. And like I would read about it a lot in terms of reprogramming your subconscious mind. You do that by affirmations.
Correct.
By believing and like saying to yourself to reprogram the subconscious mind, because it could go in different directions if you don't feed it properly. So I started implementing it into my morning routine. So anything that I see as beneficial, I try to add it to the morning or the night routine. And I started adding it. I have been doing it every day since then. So it's been like 5 years. I want to say 5. COVID kind of throws me off sometimes. So yeah, I think it's about 5 years. I have seen some of the things that I wrote that stuck in my bathroom on the wall, or things that I would say generally, because I do for physical, mental, emotional, all these things. I see it actually happening. I see it unfolding. If it's not happened yet, I see it unfolding. So I always tell everybody to do it. It's such a good practice to add.
Yeah. I agree. I do practice affirmations.
Yeah,
and
it's good, huh?
Yeah. And it's simple, similar to what you said there in terms of being routine. I think in entrepreneurship, you have to be somewhat routine, which is also a product of being disciplined.
Yes.
Right? So yeah, I think that's something key for entrepreneurs.
Yeah.
So what confidence is a big part of what you help people regain, right? But what does confidence mean to you?
What does confidence mean to me? Confidence is knowing who you are and, not letting the external circumstances or what people say affect that unshakable faith within yourself. You know who you are. And because things may happen or people may remember past versions of you, and it takes small things sometimes to chip away at your confidence. But at the end of the day is how you view yourself.
Right.
And confidence really comes from within. I help patients, like when I help patients complete their smile, like they have a broken front tooth or they're missing teeth and they get dentures, I could see their face light up. You could feel their sense of self come back, you know, what they would have lost before, and they're so happy, I think that's a really important part of the job. It feels good to know that you have given somebody something, like, or you've awakened something within them that they're like, they're happy about.
Your smile goes a long way.
Yes. Your smile makes an impression before you do, most times.
Beyond dentistry, you're now expanding into facial aesthetics. What drew you to that field in particular?
Honestly, I feel like now everybody is really super self-conscious with their looks, and we talk about confidence being an internal thing. So I would always say, like, these outward things is just supplemental. It's like a band-aid sometimes.
Correct,
But
yeah.
it really needs to come from within, right? But I mean, sometimes little things could help you,
With the
along the
confidence,
way,
yeah.
right? So I've never really gravitated towards Botox or dermal fillers. And when I heard about PRF, platelet-rich fibrin, it seemed like a more natural and holistic themed way to go towards helping people kind of regain a bit of confidence or boost their confidence levels. So as I was reading up more about it, I saw, this course to do it. And I feel like a lot of people kind of into that now. But as I say, I'm not really into the Botox or the fillers yet. So I thought this was a good alternative
Right.
for that.
So tell us a little bit more about what the PRF is.
Okay, so PRF is basically where we draw some of your blood.
Right.
So you're using your own blood. It's
Right.
nothing external. It's nothing that... So with dermal fillers, I don't know if people know this, but most times it's not dissolved. It just migrates somewhere in your face. And if you don't have ultrasonic guidance, I believe, to locate it, you can't really dissolve it. And even when you're dissolving it, you're sometimes dissolving tissues around the filler and these kind of things that I think is really not that healthy. So the PRF, as I say, is a natural way of enhancing your skin, and it helps. So when you spin the blood, you're using the top part, which has all the beneficial cells, the growth factors, cells that stimulate collagen, and you're using that to inject into your face. You could use it for hair restoration. It's for fine lines and wrinkles. You could
Right.
use it to plump your lips a little
A
bit.
number of different
Things.
Yeah.
And you get a more natural result.
Right.
When I saw this before and after, this is what kind of drew me to do it. There was this ad with this lady, and she was about 60 something, and she was saying, I don't want to look like a 30 something year old. I just want to look like a younger version of myself. And that is exactly how she looked, a very natural, younger version of herself.
Right.
And I kind of gravitated towards it because of that natural result. It's not looking like when people do Botox and fillers, they all kind of have that same look.
Yeah.
It's just a natural you, more
Gotcha.
youthful you. Yeah.
Okay. So, how do you balance your passion for dentistry with your personal life and other interests?
That's a tough one. That's
So
a
there's
tough
no
one.
balance.
No, there is a balance, but I think I need to learn how to listen to my body more, which I have been trying, because there is no limit with me sometimes. I feel like I could do everything. And I have to be reminded I'm not a robot sometimes. But balancing, I try to balance work, gym, and I always say it's important to have extracurricular things you're doing. Even if it's yoga, I would do spin sometimes. I used to do taekwondo for a few years.
Right.
I only stopped that because of the balance, honestly. The balance was
time.
being thrown off. Yeah, classes like Monday, Wednesday, Friday from 6:30 to 8. And, I'm waking up really early some mornings to go gym. Sometimes the alarm goes off at 3:15 and I have to get ready, go gym, go to work, and then come home and, so now I try to balance it where I have to at least do a class, whether it's something easy like a meditation class or spin or something high, more intensity. At least twice for the week, I need to go to a class. As I feel like I don't feel like
you.
Good, yeah.
So
I think it's a good... I strike in an okay balance here, but I always feel like,
like you could do some more.
Some more, yeah.
That's what entrepreneurship does to you.
Yeah,
Sometimes you just want the extra hours in the day.
Yeah.
And a big part is actually waking up early. I noticed you said 3:15.
Yeah, not every day. I don't wake up 3:15 every day, but the days that I do, honestly, I feel unstoppable when I go to the gym in the morning.
Yeah. That boost makes you feel like, you're on top of the world.
You could do anything, literally.
You believe in meaningful relationships with patients, right? How does that impact your work?
I believe like relationships with the patient is more important than... I think that's like the foundation for anything. So when I build a relationship with a patient, I'm not in it to try and just do the dentistry and leave. That's not really my goal. My goal is actually to build a relationship with the patient. I love getting to know my patients, what they do. A lot of times we have things that are in common, and I like building that kind of friendship where they feel comfortable with me. If you're uncomfortable with something, you're able to tell me. I could suggest something to you. It's an open relationship where I could, we could have, like, we could joke around, that kind of thing, how comfortable you are with the patient. And it just helps put them at ease immediately once the relationship starts building. And that, I think, is very important, to have that trust. Yes, because as you know, it's a scary thing for them. So having that trust, I think, puts them to ease a bit.
Would you agree that it also assists with the business aspect because it could lead to referrals, it could lead to the entire family coming?
So yeah, even this old patient I had, he's such a sweet man. He was like, I told everybody about you. I told them to come, but some people say they have their dentist. So I was like, I appreciated it so much that he went and like tell people about it. But everybody really, when they come into the office, they're like amazed at the little things I have in place. Like, instead of magazines, I have self-help books in the waiting room. I have the meditation room. I also have a TV on the ceiling for them to take their mind off if they want to watch a movie. The kids love that one. The kids, once they have a screen, they open it, they let me do whatever. But once somebody has the experience, because I always say coming into the office and doing something is an experience to have.
Yeah.
And when people do it, they cannot help but go and tell somebody else about it. So, but I think that comes from just being genuine and authentic in what I'm doing.
Yeah.
So, yeah, it does help in the business aspect.
Okay. Can you describe a moment in your career where you faced a challenge and overcame it?
Yeah. Yeah, I feel like challenges come in dentistry almost every day. You have to kind of think about what you should do. Some things are not straightforward textbook things like what we learn in school. Sometimes you really do have to think out of the box. I can't pinpoint a single challenge right now, but there are a few that you face, and sometimes it's important to take a little break. Sometimes, like, procedures could go a little bit long. Like, for example, a very difficult extraction. It's important to take a little break. Let the patient close, let them, come, like, get a little relaxed from the jaw being open. You step out, have a sip of water. And I find that helps a lot. When I come back in, things kind of work out a little bit better, and I overcome whatever challenge I have to overcome with that small little break and just stepping away.
You get a little bit relaxed.
Yeah. You kind of, because you keep going at it, and it's just like, exude a lot of your energy.
So, have you ever dealt with imposter syndrome? And if you had, or even if you didn't, what would you recommend for someone in terms of dealing with that?
Yeah, I feel like most dentists, well, I don't know. I feel like I'm a perfectionist. So I do come down on myself a lot.
Right.
And sometimes that could get to you a little bit. So I have to be reminded, and I have a good support system. My mom, my fiance, they remind me that, sometimes things happen. You did your best. And I always do my best. And sometimes you don't feel like you're the best at what you're doing when mistakes happen or when things happen. That
you criticize yourself.
Yeah, you criticize yourself. I criticize myself a lot. And then I'm like, you know what? Okay, after I take a few deep breaths and have them tell me, well, you're human. Be reminded of that.
Yeah.
I kind of okay with it. And anytime anything happens, it's how you deal with the situation.
Right.
So I always tell the patient, what's going on, whatever happened, explain things to them, and move past it like that. But it's sometimes not as easy because you kind of just be down on yourself a lot. Yeah. Okay. But I think coming back to the mindfulness and the meditation, those things kind of recharge me.
Right.
Yeah. So eventually, when I give myself some time and do what I have to do,
it gets you back grounded.
Yes, I get back into
like a reset.
Yeah, good headspace.
What is the most fulfilling part of your work, and what keeps you motivated?
I think the most fulfilling part would definitely be the relationships I build with my patients.
Yeah.
That it really does warm my heart to get to know them. And when I like this patient I had no teeth at all. When I was able to give him his complete dentures for Christmas, that was something that
Heartwarming.
yeah, it was.
Yeah.
Oh, he was so happy. I was really happy for him.
Right.
Yeah. What was the other part of the question? Sorry.
And what keeps you motivated?
What keeps me motivated? Yeah. Well, that in itself keeps me motivated, but the affirmations
play a big role.
It plays a big role because keeping motivated, it really doesn't. It lasts that long, you know. It doesn't last forever. You have to be disciplined.
Yeah.
Discipline is 99% of it. Motivation is fleeting sometimes.
Yeah.
Sometimes I hear a nice song, I'm motivated.
Yeah.
But it's really the discipline that keeps me grounded in all my routines. Stuff like that. It is more discipline than motivation, I would say.
Okay. As you mentioned before, your waiting room offers self-help books instead of magazines. So what's your favorite book in that collection? And why?
There's so many. Right now, so I take one of those books, and every morning with my assistant, I have a morning routine in the office. I'm not in the office.
Yeah.
The morning routine in the office is to say a short prayer.
Right.
And then we go through the patients for the day, review their files, x-rays and whatnot. Then I read a page from a book. Right now we're reading, is it The 7 Spiritual Laws by Deepak Chopra?
Right.
That's a really good book. It's not my favorite, but that's one of them.
Right.
Another one that's coming to mind is The Celestine Prophecy.
Right.
That was a really nice book.
Okay.
I usually don't like storytelling books, but that was a nice spiritual storytelling book. It was a really, really nice book.
Okay.
Yeah.
All right. As you mentioned, affirmations so much, right? What are some affirmations you live by that help you get through your day?
I can do anything I set my mind to. That is one that is ingrained.
Yeah.
That starts with on my shoulder. Yeah, because I do believe once I set my mind to something, I will get it done. But there's a lot I do. I do, as I say, for my body, for health. I say, like, you know, my bones and joints are strong. Every morning after I bathe, I do body affirmations. And I put on any affirmations that I'm more leaning towards on YouTube as soon as I wake up, because when you wake up, your subconscious mind is more absorbent, is in the theta brainwave, so it's easier for it to absorb all the affirmations and reprogram the subconscious mind. So it depends on whatever I'm feeling. So I don't have any favorites, but the ones that really empower me is like leadership affirmations. Yeah.
You touched on something there that similar to me as well, because there was a book I was reading that The Monk Who Sold His Ferrari.
I heard that.
Yeah. You read that book? Yeah, they spoke something similar that you mentioned then about the time that you wake up. Around 3 to 4 a.m. is usually the time when you should visualize the affirmations, because that's just a magical time that actually helps with your visualization and your affirmation. So yeah, I like similar thought patterns.
That's the golden hour, I think. Is where why I think so is because the time of that morning period is when it's least contaminated with negative energies and frequencies. Most people are sleeping around 3 to 4. You don't have a lot of activity, so the atmosphere is kind of pure. It's kind of easy to tap into source energy.
Yeah. If you could go back in time and give your younger self advice, what would it be?
Probably the same advice I can give myself now. Give myself a little break.
Yeah.
I say that, I probably still won't do it, you know. But yeah, maybe to go a little bit easier on myself. I think I'm so hard on myself, and that's something everybody around me say. I'm very hard on myself, but I think it's because I have such like high expectations. I
Yeah,
set
yeah.
the
Push yourself, yeah,
yeah,
yeah.
yeah. And like I feel like you have to have those high standards and expectations to go where you want to go, you know. But I could also give myself a little break. Yeah.
Yeah. What advice would you give to anyone listening who would like to explore medical school or even dentistry?
I would say, you know, make sure you enjoy it and you're doing it for the right reasons. Because I've seen a lot of people go into medicine and they become, you know, angry or like they take their frustrations out on younger doctors or things like that. And you could tell that they're not genuinely in it. When you, and if you realize you don't want to do that, then change paths, you know, like don't stay in it because your parents want you to do it or whatever reason other than you genuinely want to be there. I'm not saying there won't be highs and lows that make you feel like quitting. Make sure that's like, you know, where you want to be and something you want to dedicate your life's work to because you can make it better, you know? Yeah.
How can entrepreneurs create a strong brand identity that attracts and retains customers? What is your perspective on that?
How can?
How can entrepreneurs create a strong brand identity that attracts and retains customers?
I think by being authentic. I think that is you don't have to think too hard about being authentic. Once you're authentic in yourself and you're genuine with the people that you're not trying to cheat them, you're not trying to outsmart them in any way. I think that is what retains. People could feel energy. They could feel when you're trying to be sneaky with them. They could feel when you're trying to outsmart them in some ways. Business is business at the end of the day, but once you're doing stuff with a pure heart and you're really giving it your all, you're trying, your people will come. And I think there's enough for everybody. So I see things in abundance. I don't see it as, you know, or people always say, you know, you don't have much competition or I don't even
You have
care
an abundance
about that.
mindset.
Yeah. So there's enough for everyone. And
Yeah.
I don't want all the patients come to me. I want the people that will appreciate my space come to me. I want the people who appreciate me and appreciate the, you know, what we're offering. So I don't want everybody, you know. I want to attract similar mindsets as well.
What message would you like listeners to take away from this conversation today as we conclude?
I would like them to not ever give up on themselves and whatever they believe in. Really give it your all, put in the work, and know that you can have whatever you set your mind to.
Right.
Yeah.
Okay. So, as we come to an end, right, we have, again, Dr. Nalinee Rampersad, right, and she will also tell us again where her practice is located and give some recommendations to the viewers concerning dentistry.
Okay.
Yeah.
Yes. So I am again Dr. Nalinee Rampersad. My office is located at KVS Plaza in St. Helena. The name of the office is Holistic Healing Dentistry. And I would like to also say, please make sure and floss every night. It is so important. It
Right.
goes such a long way and it can save you a lot of time and money. Who does not like saving money? Please floss every night.
Quick question again before we go. Are we supposed to use mouthwash exactly after brushing? Or when is the right time to use mouthwash?
So it depends on the concentration of fluoride in the mouthwash or the toothpaste. Whichever one has higher concentration, I would say use that after so that stays and
Right.
it helps to remineralize the enamel. But you definitely want to floss before so that you get all that plaque and bacteria out. And you brush it out, rinse it out, doesn't stay. The flossing, I just want to say one experiment I tell all my patients to do, which is to do this. You're going to brush the best you could brush, which is for 2 minutes with a soft toothbrush, taking your time and like consciously brushing everywhere the best you can. And then going in with a piece of floss. And when you're flossing, you're not just going up and down, you're sliding it along these hard surfaces of the teeth. I'm guaranteeing you will see stuff, plaque, food, all that has bacteria still there. So that's enough proof for you that you should be flossing every night. Because if you don't floss for 2 days, 3 days, that's or weeks or years. That's how much bacteria and buildup that's just remaining there, you know.
Okay. All right.
Yeah.
Thank you for that. Thanks again.
Thank you for having me.
No problem.
Okay.